It's just whirring at the moment. Hello, it's Jo Brett, Occupational Therapist and CEO at Starjumpz. I'm here this evening with Abir Hamza Goodacre, who has been our clinical nutritionist at Starjumpz for a number of years now. I think it's probably 4 or more.
On and off. Yeah, definitely. And before that, actually, wasn't it?
Yes, we were working together. In fact, some of you may have seen Abir in 2013, I think it was, when we had a conference, and Abir and the team from Botanica came and spoke there, which was great. Yeah. So Abir is going to talk to us tonight about why nutrition and diet matters, and especially for autism, ADHD and other neurodevelopmental conditions, and also touch on anxiety, which is our theme at the moment at Starjumpz. So I'm going to let Abir introduce herself, and then I'm going to ask her some questions. And please do ask us questions in the comments, and we will get to your questions. We're aiming to go to about 45 minutes, but if there are more questions, we'll run to the hour. So looking forward to answering your questions, and I'll just ask Abir to introduce herself.
Great, thank you, Jo. And it's so nice to be part of this interview series that you've been running with Starjumpz. I think they're brilliant. And nice to be here this evening to talk about diet and why in particular it matters for children with ASD, ADHD and other neurodevelopmental challenges. So as hopefully some of you out there have seen me before, others maybe not. So I thought I would just start by explaining what I do. So I'm a nutritional therapist, and what that is the application of nutrition and health science to maximize an individual's health potential. And what that really means is that we look at the interaction between an individual's genetic predispositions, their nutritional status, their nutritional requirements, and then we look at that together with environmental factors and create a nutritional protocol around that. Because how the individual interacts with their genes, their environment and foodstuffs really matters. And so it's getting down to that individual level that can really change health really for the better. And so I've been working with children at Starjumpz, as Jo said, for a number of years now, supporting families with children that do have certain challenges, and over the years seen really wonderful improvements in changes to their nutrition and their nutritional status. And I think that nutrition can be used to great impact along with other clinical interventions to support these children.
Absolutely. We've seen some really amazing changes in children's behaviour and their ability to concentrate and learn once some of the issues that they've been having with their gut health have been resolved. And just to mention as well that recently Dr. Liz Corcoran has joined Starjumpz and is working very closely with Abir. Liz has a background in psychiatry and is trained in functional medicine. So they work very closely together with the children we see. And just also, for those of you that might like to know, we are doing a very special offer for May and June, and we'll talk about that at the end. But we really wanted to speak quite a bit about the importance of nutrition and diet at this particular time while we're all stuck at home, because it's a great time to make some change when your children aren't going to school and you're actually able to see what what they're having to eat all day long because you're together.
Exactly.
So one of my first questions is, I think you've already sort of touched on what nutritional therapy is, but how are you working with the children at the centre? And I don't know if you want to expand on nutritional therapy.
Yeah, I'll speak a little bit about that. And, diet, we know, is key for everyone. And in particular, the children I've been working with at your centre, it has been transformational. So obtaining adequate nutrients from a varied and a balanced diet, and having the digestive capacity to support the nutrients from that kind of diet, is the foundation of health, really. And what we find in the research, and I find in my own clinic and in the testing that I do, is that nutrient deficiencies, food sensitivities, food intolerances are quite common with children with ASD, ADHD, and other neurodevelopmental challenges. And so the clinical strategies that include nutrition interventions can have quite a big impact. And so it's not just to address a health concern, but also to really maximize health and allow the child to thrive. And, you know, there have been some really interesting studies, which I am going to sort of show you. I'm going to try and share my screen at some point. That have shown that there is a prevalence of something called leaky gut, low levels of beneficial bacteria, inflammation, and immune reactions to food in children with this kind of profile. And therefore, trying to address the gut health again, which we can touch on later, and ensuring that the diet is optimized is key, just as a first point. But then there's the second point, which is addressing those food intolerances and potential sensitivities. And, you know, we'll come on to that again later. And elimination diets is one way of doing that. And I think you and I were talking, Joe, weren't we, about how now might be a good time to try an elimination diet. Because although levels of anxiety tend to be a bit higher, actually people are saying to me, you know, they're at home and there is more time for cooking and there is more time to plan, which in our busy lives we don't always have. So typically I've worked with children on their nutrition, on their gut health, and to implement elimination diets.
Yes, that's really really helpful. And so why would you say, particularly for autism, ADHD, and other neurodevelopmental conditions, and children who struggle with their learning, and maybe with social challenges, how would you say that diet can really help?
Well, I mean, you know, what we tend to see in the research, and again in clinic as well, is that what is a loss of oral tolerance? Oral tolerance is the body's ability to fight off pathogens, to fight off immune sort of factors in food. And before a loss of oral tolerance, which is basically a food intolerance, changes happen in the mucosal immune system, so that's in the gut. And when that happens, and that can happen for a number of different reasons, it can happen at birth, it can happen in the womb, it can be to do with environmental triggers, stress, antibiotics, a number of different things can affect gut health. That can lead to a loss of oral tolerance, which is kind of where food intolerances rear their ugly head, really, which can result in an imbalance in gut flora, and then that can have effect on inflammation levels within the body. And when that happens, there's a cascade really that can then start to affect brain working and brain health, and so that would lead to potential changes in behavior. And so addressing it right at the root cause, right at the basis, which is at the gut level, is absolutely key. And obviously one of the ways you can do that is to identify what the food triggers might be and remove them. You can test for that, or you can do an elimination diet. And I actually use elimination diets a lot because I think that they're a kind of non-invasive way of working out what that problem might be. But in kind of more complex cases, testing is sometimes required. And then based on that kind of knowledge, you then really need to work out what should my child be including and what should my child be avoiding. And at the same time as all that, you need to look at the gut health and make sure that whatever they are eating is being well absorbed so that it can, be used by the body in the right way.
And when a child is working through an elimination diet and things their health becomes a lot better and their behavior changes, am I right in thinking that very often you can start to reintroduce, I believe that's what you often do, reintroduce foods, and then a child can have a more varied diet than perhaps they did before? Maybe not in all cases, but would that be right?
Yeah, sometimes. So it's a good question. And actually people do ask me, and I don't know if some of you parents out there tonight might ask me this question, for example, if a child has such a limited diet and an elimination diet means that they're going to have an even more kind of limited diet, then we have that discussion, because it might be that that's not going to work for that family or for that child in the first instance. And when you think about foods generally, you're thinking, okay, what are the nutritional habits? So that means, how many takeaways do you get? What are your tendencies and habits as a family? What are your dietary patterns? So does the child say that they're hungry in the morning and then doesn't eat anything until the evening? And that can affect mood and behavior and the things that you mentioned earlier, Joe. And then what's the diet quality like? And so if a child is finding it difficult to eat any range of food, we would look at those three things: so nutritional habits, their dietary patterns, and then trying to increase the quality of the diet as a first point. Now, if they're at the point where they are ready to try something like an elimination diet, then we would so there are a number of elimination diets, but the most common one, and the one I would go to first, would be a gluten-free and a dairy-free and soy-free diet. And so what you do with a diet like that is that you eliminate all those foodstuffs in food and drink, usually for a month, but it depends on what we agree in the clinic room. After that time, well, in fact, during that time, the family, I asked them to keep a food diary and to note any changes, not just in mood, behavior, emotional status, but also in digestive health. And then at the end of that time, we usually actually have a discussion before they start to reintroduce the foods. And I have had parents, as you know, Joe, who have noticed such an improvement on the elimination diet that they're loath to put some of those things back in because there's been such an improvement.
And actually the children too recognize the changes in how they're feeling, and will tell us and will tell their teachers and other people who offer them anything what they can and can't have, and are really happily taking it on, and that is really wonderful to see. We've had some comments and questions already on some of the things you've touched on. So and a couple of them are to do with limited diets and children who are very picky eaters. And one thing I just want to ask you to mention is about for children who are very limited in their foods. I know you talked a lot about zinc being something that they might be deficient in, and I wonder if you could just touch on that, perhaps.
Yes, it's actually the first point in, what do I do if I have a fussy eater? And one of the things that you can look at is their nutrient status, and I do think testing is a good thing to do here, to work out what their blood levels of certain nutrients are. Some of those tests can be done through the GP, and others I can arrange through functional laboratories. So if our zinc levels are low, we tend to have altered taste levels and altered smell, and so food doesn't taste very good. And so if food doesn't taste very good, then typically a child is not going to want to eat it. And if the child is very young or they have difficulty communicating, then they won't be able to tell you that. It will just result in freakouts at the meal, or just meltdowns before a meal. So I do think that having the right nutrients in the body and optimizing nutrient status is a first point. And actually, that's very important at this particular time. I'm finding it fascinating with this COVID virus, the loss of smell and taste that people are experiencing. And you do have to sometimes look at what their nutrient status might have been before that, zinc-wise anyway.
That's really interesting. If I'm looking down and looking like I'm not listening, I am listening. I'm looking at
I know you are.
Just so everyone knows. And I just do need to check that my plug is plugged in as well in a moment. So also with fussy eaters, I'm an occupational therapist, and we work very closely with speech and language therapists, and we will all work together with the beard to look at some of the children who may be fussy in their eating, because, for example, they may have problems with muscle tone that make chewing a bit hard for them, or they may have some sensory sensitivities to smell and taste that can actually make it very difficult for them to tolerate different things and different textures of food as well. They may like things to be a certain texture, and they may find certain things really uncomfortable to have in their diet, and it can even be that they decide that one colour of food or food that isn't cooked to a certain way is something they're not going to have. And we are looking at in the very near future setting up a clinic working with Abir and Dr. Liz on speech and language therapy and OT on sensory issues in feeding, so that we can do some collaborative integrated work in that area. Do you have anything else to say from your perspective on limited diet and fussy eating?
Yeah, I mean, the thing is, one thing that's very interesting is in my questionnaire that I send out to parents before I see them, there's a question that says, what foods and drinks would your child find it very difficult to give up? And it's sometimes, or often, it tends to be the foods that may be problematic. It's almost like they're addicted to those foods. And I often see pasta and cheese, or pasta and yogurt, or ice cream, that kind of thing. And so it is very difficult to wean a child off something that they absolutely love, and yet those are the very foods that might be problematic. And I'll give you an example with that. So gluten and dairy have agents in them that can sometimes not be broken down properly by some children, particularly children with ASD, ADHD, and other neurodevelopmental issues. And there is a test you can do. They're called glutamorphins, and they are also, glutamorphins is the gluten one, and casomorphins, which is the dairy, and there's actually a soy morphine one as well. And as I'm saying that word morphine, maybe you're getting the idea of what these foods do to these children. So they don't always have the enzyme required to break down these foods properly. And so the byproducts of that are kind of opiate-like structures in the body that act like opium on the brain. So number one, it can make them, I suppose, feel good in some ways, but it's quite addictive as well. And on the other hand, it can make them quite as though they have a sort of brain fog. And that's the biggest thing I've noticed with the removal of these foods, is parents saying that the child is able to concentrate more. I mean, one parent once said to me that their child went from barely reading anything on their own, 1-2 pages a night if really pushed, to suddenly reading 10 pages a night. And it's that kind of response to an elimination diet that, without even testing, that those foods are problematic, and yet that child's favorite foods were those things.
Yeah, that's and I think one thing that's worth saying is that it's really difficult as a parent, as well as anyone, to kind of make sense of all that gets thrown at you about what's good and what's bad for you food-wise. It's very confusing. So I think particularly for children who are struggling, looking at diet is so important, because you could actually make such a significant change to how they're managing things that it's almost like one of the first things to be considering to do.
Well, Jo, it's interesting because for the parents who've sent the questions about the children being fussy and difficult, I know it's actually quite overwhelming to think about an elimination diet. I've tried it with a child that's not fussy, and it can still be overwhelming. I think the way, and I've worked with various families recently, actually, where we talk about the possible benefits of an elimination diet, which there often are. But if the family is not ready to do that, and particularly if it's your first foray into looking at nutrition and the impact of nutrition and gut health on mental well-being, then we look first at nutrient status, so the basics. We look at what the diet is like now. So if it's not a very varied diet, then I'd be looking to increase the variety within that diet. So keeping everything in as it is, so as not to also overwhelm a very anxious child, but to slowly start to change that kind of the environment, not just on the plate, but also inside, just by increasing variety of vegetables, for example. And children are more resilient than we sometimes think. Well, we see it, don't we, all the time, and parents see it a lot, that they are willing to sometimes change, and it just takes a bit of time, that's all. And then after that first phase, then the child might be more amenable to other changes, particularly if they've felt improvements, in just by changing their diet to make it healthier.
Absolutely.
So it can be done in stages.
Yeah, I've got a question about do hormonal levels throughout a child's development have implications on their diet, especially if they've got a neurological condition.
Do you mean their needs?
It's a question from one of our people who's watching. So I don't know if you would like to post further on your question, but
I mean, I would say that just while she's maybe posting or he
yes.
is posting something, I mean, children's needs, yes, I mean, I suppose in terms of calorific needs can change with hormonal changes as well. And, you will often find changes in appetite levels at certain times in their development. But in terms of need, and also, yes, certain nutrients or micronutrients are needed in greater quantities as the child grows up. But I mean, we all need a basic set of nutrients, that's minerals and vitamins. We also need a basic set of macronutrients, that's your proteins, your fats, and your carbohydrates. And we need a diverse range of vegetables and fruit. That is absolutely key. And, I've been reading various studies recently that show that even just by increasing the diversity and the range of vegetables and fruit on a plate can reduce anxiety scores. And that is across the board in women, in children. The study was done on women because more women suffer with anxiety than men. But I'm reading it in so many places now that we know that just elimination diets aside, having a diverse diet can improve all those kind of markers of mental well-being.
So I've got so the further point to that question is yes, their needs and or influences on their taste, etc.
Well, we know that it takes about 20 to 30 tastings to actually like something. So I think that the key is from quite a young age, if possible. And I know it's difficult if the child is fussy, but to always be offering that varied plate because they see it and they see it as the norm. And when something is more normalized, it becomes more acceptable. And allowing a child to taste a food and then spit it out if they really have to. And there are strategies that you can take to help them believe that it's going to be good for them and that they would want to do it, to allow them to have that kind of not power over that, but their choice over the food is important. And in terms of their needs changing over time, I would say that your needs generally are always fairly similar in terms of what the things I said, the macronutrient needs, the micronutrient needs. But yes, I mean, I suppose as you hit puberty, zinc levels in boys and girls are important for sexual maturation, and other micronutrients would be needed in increased amounts. But you would get that from a varied diet.
So same question, not the same question, but from the same person who's joined us. Do you recommend children with ADHD and or ASD, which is autism, should take a probiotic daily?
Yeah, it's a good question. I actually I really want to show you some studies here.
Okay, I'll just take myself away for a second so you can.
Oh, how do I share my? Will it just say share my?
It's the 1, 2, 3, 4, 5th one along, I think.
Okay.
Sorry, and at the very bottom of the screen, there's an option
I'll do it today. I'll answer the question. I'll do it in a moment. I'm not the technology. So I think a probiotic, I mean, is a good insurance. Now, there are so many probiotics out there, and choosing the right one can be tricky because sometimes people take probiotics and don't notice any difference. There are specific ones that I will use that I do find very good because they support the immune system in the gut. But it would depend on the individual because there could be a number of different issues going on actually that would require more than just a probiotic. And actually, I do want to share something now. So I'm
okay. So
it.
At the bottom of the screen, Abir, you should be able to see a button that says share screen.
Yes, I've got it.
I will disappear for a moment so you can do that.
Okay. I hope you find this useful, and hopefully can you see my screen? Oops. I'm hoping you can see my screen. Okay. I've got this diagram here, which I think is quite a good illustration of the gut, and it will hopefully help.
Abir, sorry, we can't see your screen yet.
Oh,
sorry.
Okay, hang on.
Or if you just want
there
to
it is. I've done it. I've done
okay.
it. Yeah. Okay, so hopefully you can see my screen now. Yeah, and I hope that this helps to answer the question about probiotics and why, yes, I think they're useful, but it can be a little bit more complex than that. So this is a picture of a healthy gut. And as you can see here at the top, I hope you can see my cursor. What this is showing, and this is in the lumen of the gut, is the high diversity and protective strains of probiotic. Okay, so what it's showing is that there's a good diversity, and I think diversity, not just in diet quality, but in microbiota, is absolutely key for overall health. And what this also shows is that there's a low level of pathogens, so things that are trying to perhaps, attack the gut. Now, for various different reasons, this good diversity of microbiota can reduce. Antibiotic use is one cause, environmental factors, but also a diet that is low in fruit and vegetables, as an example. Now, when that happens, pathogens, opportunistic ones or even other ones, can rear their ugly heads, basically. And what that can do is then affect this mucosal barrier here, which hopefully you can see as I'm pointing to it. And all this stuff in here, this blue, is the kind of jelly layer, the mucosal layer. And when that gets attacked by what's going on in here, it can cause problems.
Hi, Abir, sorry to interrupt, but we can't. I wasn't sure if other people could see your screen yet, but we can't see it. So if I do it like this,
can you see it now?
No. Oh, yes. Hang on a minute. Let me add this.
Can you see it now?
Yes, we can. Yes. I'll stay with you. So, yeah, we can see it.
Fine.
Thank you.
Sorry, everyone. Sorry. Did you hear everything I said, though? I'll just show you the picture again. I'll try and go through it quickly so you can see it.
Yeah. Yeah.
Okay. So this is a healthy gut. It's an image of a healthy gut. This image is showing a high diversity of protective strains, so diversity being the key word, and a low level of pathogens. If for a number of different reasons that diversity is reduced, pathogens can rear their ugly heads, and this mucosal barrier, which is strong in this picture, can become weakened. And as a result of that, this mucosal layer doesn't become so nice and jelly-like. It becomes drier, if you will, and that can cause a level of inflammation here. At the moment, there's low mucosal inflammation and what's called strong, tight junctions. And when that happens, you would see an image here of gaps within this tight junction here, which is basically what leaky gut is. And then you would find inflammatory markers and undigested proteins traveling through this tight junction here, which is no longer so tight, and moving into the bloodstream. And then that can affect other tissues in the body and also affect brain function as well. So your question around whether a probiotic is helpful, yes, it's helpful because it helps to kind of crowd out maybe pathogens that are there, or dysbiotic bacteria, which are not so good. But sometimes it's not enough. Sometimes you actually have to remove food triggers, for example, which we're talking about today, environmental triggers as well, in order to stop that kind of constant kind of thorn in the side. And then you also have to go in and heal this mucosal barrier in order to be able to, I suppose, heal the gut. I hope that was helpful in terms of an image.
Yes. Shall I go back to both of us?
Yeah.
Okay. So somebody has asked, what are the symptoms of leaky gut?
Okay. So here's the thing, and this is tricky because sometimes people come to me in my clinic and the child has gut issues. Okay, so and you can't always say there's leaky gut, because sometimes it's just some gut issues like IBS, which wouldn't necessarily mean leaky gut. But if they have gut issues, sometimes I will request certain tests to find out what is happening in the gut, and there is a test you can do for leaky gut. Symptoms of leaky gut can be felt in the gut, yes, but sometimes they are not even felt in the gut. And that's where it's harder to talk about, really. You know, you say to someone you have leaky gut, but you go, well, actually, I never have digestive issues. I have normal stools every day. How can I have leaky gut? But when you have leaky gut, it can, as I said, as you saw from that picture, send undigested proteins and inflammatory markers to the rest of the body, and cause inflammation elsewhere, which could result in joint pain, brain fog. If anyone has any autoimmune condition, I would suspect leaky gut. So that's another thing. Dyspraxia, a number of the things that children with ASD and ADHD suffer from.
That's helpful.
Mood disorders.
We've had some questions about supplements or multivitamins for children. Are there any that you can recommend, or what would your advice be on
Supplements?
That?
So I think that if you were just going to go and buy a supplement, I think a good probiotic, and I can recommend one, is a good place to start. I also highly recommend omega-3 oils, particularly with a high EPA content, and a good multivitamin and mineral supplement as well. If those were and vitamin D, okay, that's 4. But those would be, I suppose, as a kind of blanket. But I really think it depends on the individual. And so the approach or the protocol is typically optimize the diet as much as possible, because actually research has shown that if you just take a multivitamin and a mineral supplement without improving the diet, it doesn't have such a beneficial effect on mental health as when you change the diet. So that's worth noting. But yeah, those would be the 4 supplements I would recommend.
Thank you. So we've had a question on, are there any food supplements or any things you can recommend for a child that might need help to relax or to sleep?
Okay. Yes. And yeah, okay, so I would ask them what their diet is like in the day and that kind of thing. So we know that an imbalanced gut flora can cause localized inflammation in the gut, which can then affect other parts of the body. So I would say looking at gut health again is quite key. And there's been some quite compelling research that's come out on the use of probiotics for reducing anxiety, together with a healthy diet. But if they have trouble sleeping at night, so looking at that in their diet in the day is important. The probiotic could be useful. Magnesium is also quite relaxing, so that as a supplement might be useful as well. But I know sometimes that's not enough. So together with nutrition, I would tend to use lifestyle strategies as well, which I'm sure you're already doing anyway. But yeah, magnesium would be a first place to start, actually. Okay. With that, yeah.
Okay, we've got a question about manufactured foods and whether they can increase hyperactivity in children, and in particular in ADHD. Don't know if you could.
Yeah, you mean like processed foods?
Processed foods, yes.
Yeah.
I think that's the implication.
Yeah, so the thing with children, particularly with ADHD, is they tend to respond more sensitively to food additives. And I suppose when a food has been processed, lots of things go in there. Certain things like monosodium glutamate and aspartame are often included in these kinds of foods. Both those agents contain glutamate in monosodium glutamate and aspartate in aspartame, which actually occur naturally in the body. And so the brain doesn't distinguish between what's fake and what's not fake. And because the gut and the brain are so intimately linked, these agents can cross the blood-brain barrier, and they are known as excitotoxins. So they can basically excite the brain cells and cause behavioral changes. So those 2 things are certainly problematic in children with ADHD, but also food colorings. There are salicylates, which actually are found in natural foods as well, but in particular in food additives that can cause anger and behavioral changes in children who are particularly sensitive to these foods. And one way, sorry, just quickly to say about describing children who are sensitive, children particularly with ASD and ADHD, is that they are sometimes seen as the canary in the coal mine. So whereas another child might not react to it, or one of your other children, that child does react to it. And that's why it makes it so important to think about what should my child be including and what should my child be removing.
That's great.
Yeah.
I've got a question about a child who started taking melatonin, and since taking melatonin, he suffers with awful burps that smell of egg, and he gets the taste of egg in his mouth for hours, and this can happen 3 times a week. I
Right.
don't know if you've come across that and whether it could be related to his gut. I haven't heard
I
anyone
haven't
mention
not
that in relation to
well, I
melatonin
haven't
before.
not to melatonin, but
Yeah.
you're thinking about the sulfur in the so is it after eating eggs, or it's just from melatonin, it happens anyway?
I think it's just after melatonin, so it's nothing to do with eating eggs as far as I can tell, unless
Mm.
you want to correct me.
No, I actually would like to look into that. I haven't heard that
Yeah.
happening before. I can only think that it's happening because of some changes in the sulfation pattern, which happens in the liver as a result of melatonin and how that child is breaking it down, which might result in that kind of symptom.
That's
Yeah,
interesting. Thank
so
you.
it could be to do with that.
We've got a question on uh, a child being addicted to sugar. She
Mm-hmm.
has autism, and child seems to calm her. Sorry, and the sugar seems to calm her.
Mm-hmm.
Is there a connection between autism and desire for sugar? It's a
Yeah,
big question.
well, more so with ADHD, but you do see that kind of, I suppose, that slight OCD tendency towards certain things in ASD, obviously. The sugar will make her feel good. And so that's why she might want it more. I do think that balancing blood sugar levels, though, is absolutely key in children with ASD. And so weaning the child off sugar by making sure that the meals are well balanced, in particular having enough protein in each meal and snack, would actually reduce that tendency to want sugar so much. And also there is something to be said for looking at her gut health as well, because if there is a kind of dysbiosis in the gut, which means that the diversity has been lost and there are a kind of unwanted bacteria rearing their heads in the gut, particularly yeast, that can cause someone to want more sugar than someone who has a normal gut flora. So I keep coming back to the gut flora and the microbiome and the mucosal layer, because it really does determine choices that we also make with our food, because their genetic material outweighs ours, so they have a lot of power.
Need to tame them. We've had some questions on which probiotic brand would you recommend?
Okay. Well, I mean, I would say it depends on the individual, but there is one brand that I use a lot, and it's by Culturelle, and you can send it later maybe. It's Lactobacillus GG. You can order it on Amazon, I think, although lots of places seem to be low on stock at the moment, or through a company that I use called Nutrilink, and I find that very useful. But it is that one particularly has been shown in research to support the immune system in the gut. But I also use other things alongside that. But yes, that is a good one.
Yeah, and I think it's important to note that whilst it is, it's good to try some of these other things. Sometimes, because of the complexity that your child may be, or the complexity of the issues your child may be experiencing with their health and their gut, it might need more than just over the counter or ordered supplementation.
Yeah.
We've had a request on whether, what supplements do you recommend? And again, I think you've touched on that for some children they need testing, and I know Dr. Liz has as well. So I don't know if there's a general sort of supplement that's an option if somebody is not able to.
Yeah. If they're not able, I do think like nutraceuticals, so supplements, they do make the difference sometimes, and I do tend to use them in my practice. But I think the diet is absolutely key as well, because if you don't for example, going back to the elimination diets, which I'd like to go through in more detail in a moment, but
Yeah.
if you don't remove foods that are problematic in children, then yes, you can use a supplement. And I've had this happen with a number of my patients, and it helps. Okay, they take a probiotic, the ones that I deem that might be suitable for that particular person. Either I know that through testing, or we've had a discussion and I use products that I tend to trust and have used a lot, and they notice a difference. But then when they stop taking that probiotic, the behavior comes back or the symptoms worsen. And what that's really shown me is that although it's provided some relief in the short term and supported their health, the environment in the gut has not changed. It's just almost been a bit like a plaster. And so in order to make lasting changes, it's got to be a multifaceted approach to the gut health and to the diet.
Yeah. And we've had a question on probably a similar answer, but how much magnesium would you give a child?
You could give 150 milligrams.
Yeah.
And maybe twice a day if you had to. Yeah.
Yeah.
And there are some brands, you have to be a little bit careful. It can cause loose stools. So a magnesium citrate would probably be more tolerated. Liquid magnesiums tend to have less of that effect than tablet form as well. And going back to the question on the supplements, I do think a fish oil is a good thing to give to children with ASD and ADHD. An omega-3 oil is good. Vitamin D is absolutely key.
I know. Sorry, I was just going to say.
Yeah.
Our paediatrician, Dr. Georgie Siggers, will often recommend fish oils and probiotics. I think when she sees children, and as well as refer on to Abir and Liz when she feels that's really important. Is there any top tip for a child who can seriously withhold passing stools? She has a daily laxative, but can still hold on to it, resulting in awful behaviour. And I think this is a really good question, because it's something we see an awful lot. And, being able to break that pattern can just really make a massive difference.
Because, I suppose you have to ask the question of why is she holding onto the stool? Well, it probably hurts, when she goes to the loo, because she might be constipated. Sorry, I'm just guessing, but maybe
but also potentially anxiety and stress causes constipation. I think, and for a lot of children who have a lot of sensory sensitivities, we see that as well, that they can become very constipated because they're just so tense. They're just not letting their body relax.
I know. And I think what you just said it's so true, and it just highlights the fact that it really is why Starjumpz is so great, is that integrated approach. I mean, it's not just nutrition, it's not just gut health. It is all these other therapies that you offer that support that child. I think with that, I mean, one example I have that might be helpful to this parent is that I recently saw an autistic child at a center that's nonverbal, and before going to the loo every time, you'd make a huge ruckus, so much noise and shouting and banging. And we discussed his diet, and we didn't do any testing, but we discussed the diet, and we agreed that they would avoid dairy for a period. And after avoiding dairy, even just for a week, there was just hardly any sound before going to the loo. There was hardly any banging. So, that particular child who was nonverbal couldn't show that they were in pain in any other way, but they were obviously anxious as well. So maybe a hidden in food intolerance might be there, but also strategies for calming down, not just through, behavioral strategies, but also some nutritional supplements like the magnesium and others, can be useful in just calming that sympathetic nervous system down.
Absolutely. We've done a recent talk, Anya Kennedy, occupational therapist, and myself talked about sensory processing and how that affects anxiety, and that's another thing that can help. And Dr. Liz Corcoran was also talking about anxiety. So there are some past lives that we've done that might be helpful. But that's a very good question. Got some more questions for you before you go on to the elimination.
I'd rather just start, the questions is good.
Lou has asked, What about prebiotics? What about
Mhm.
giving children prebiotics
Yes.
rather than probiotics? Yeah.
Very good question. So that actually is part of creating that right environment in the gut. So probiotics are the good bacteria, and I say good, it's a whole diverse family of bacteria. And the prebiotics is the food that the probiotics need in order to flourish and grow and be maintained. Now, if you eat a diet that is varied in vegetables and fruit and good quality fiber, you will likely get prebiotics in that kind of diet. If it is not full of that kind of food, there are supplements that you can take, and I have a good gut healing protocol that I use that does include prebiotics in it as well. But I'll just say one thing is that if the gut is in a really inflamed state, and you would know that from doing a test, and actually also sometimes from symptoms, and you would just go straight in with the gut healing protocol. If you start to give all the tools the gut needs to heal itself before actually reducing inflammation by giving a good quality probiotic, and I often use colostrum as an immunoglobulin to reduce inflammation. If you give the other stuff first, the body doesn't really know what to do with it. It's like throwing some tools at a broken car and saying, mend yourself. So often you have to reduce inflammation first. And as I said, I will often give a probiotic and immunoglobulins from colostrum for that, as well as try an elimination diet. Otherwise, there's constant food triggers. And then you would go in and put the prebiotics, like start to create that right environment so that the gut can do it basically by itself.
Another question on probiotics. Is it all necessary to give them on an ongoing basis?
If you haven't corrected the underlying issue, yes. And if
Good,
you're
yes.
doing that, I would rotate them as well. There's a lot of research and talk about probiotics, and the most recent thinking is that there's four keystone strains of probiotic, and if you don't have those in good quantities, then you will have generally issues in your gut. And so there are some products out there that can help to cultivate the production of those keystone strains, but also having a varied diet will help to do that as well.
Yes, thank you. On a varied diet, can I just ask you, number of vegetables and number of different kinds of fruit a day for children? Is there
I mean,
anything you would throw out there?
well, I don't want to throw too much because even, me with children, hard to get as many vegetables as you'd like in there.
Yes,
Okay,
ideally,
so
yes.
the government will say 5, won't they? And my association, we've created a plate that says 7 vegetables and 2 fruit. But I know the Institute of Functional Medicine goes up to 13 or more on a plate. And I know that can be difficult. Doesn't mean they have to have tons, but it's the variety that's important. Because even though we know, I mean, not just from the fiber point of view, but even though we know that there are a set number of minerals and vitamins, the phytonutrients, which are the nutrients in plants, number more than 10,000. And we know about some of their biological effects, but we don't know about others. So it just gives you an idea of how important including a variety of plant foods and colors of plant foods on your plate can be.
Thank you.
Let's say 7 though for now, to answer the question.
Yes,
Yeah.
and can things like herbs or spices and that kind of thing count as an ingredient of variation on a plate?
Yeah, without a shadow of a doubt.
Yes, because I
I'm
think
glad you
sometimes,
mentioned that.
you
Yeah,
don't always think that that kind of thing added counts as an actual different ingredient, but
yeah.
it can. Yeah.
I mean, herbs and spices are medicine, actually, as we know,
Yes.
herbs.
Yeah.
They're used, I would say, that to spice up your life, to add as many herbs as possible. They tend to be actually very concentrated in nutrients. And in this country, well, we do use herbs, but when I could think about the Indian culture, herbs and spices, they're used more than just as condiments. It's in everything. And I think it is very important. Yeah.
Thank you. A question on a ketogenic diet. Could that be
Hmm.
beneficial for children with ADHD?
Hmm.
Um, or is the reason for this merely to reduce gluten and sugars?
I would be mindful of a ketogenic diet. I think there are some short-term benefits, not in children. I wouldn't recommend it for children. Short-term benefits in adults, but I would say that what I have seen over time is that it can begin to affect the thyroid gland and metabolism. So I think that I would not go down that route personally as a practitioner.
Okay, thank you. I have a question on offering children fruit when they really want chocolate, and
Mhm.
both have quite a high sugar content. Is there a good argument for saying why the fruit is better?
To the child.
Yes.
Um, I would say that when you're trying to introduce something new, let's say the child really is addicted to sugar, to suddenly not give any sugar in the form of chocolate and to just
Or
replace.
sweets like Haribo. Yeah.
Yeah, so it would be difficult. And so I would tend to offer the fruit with something that they like at the beginning, to make it more palatable and to slowly talk about why. So it's education, and children are sponges, they really take it on board. And I even notice my children as they get older, yes, they make poor choices, but there are certain things that they're now doing through, sort of ramming it down their throats. No, not really, but over the years, just talking about it and how it makes you feel in yourself, how your body feels better, how your mood would be better, that the child will take that on board. So I think it's offering it with something that the child likes initially, and then maybe transitioning away from that, but then also looking at what their main meals are like. If there's not enough protein in their main meal, so for children that only want a plate of pasta with very little on it, they are likely to be craving something very sugary quite soon after. Whereas if they'd had a piece of fish or meat or something like that at a meal, with plenty of vegetables, I know I'm getting a bit ideal here, but they are less likely to crave that
Yeah.
very sugary thing. So it's about what the main meals are like as well.
We've I actually noted the time is actually we've gone past 45
Mm.
minutes. We've only got less than
Okay.
10
Yeah.
if we're going to cover elimination diets. We've got 2 other questions. I
Mhm.
don't know if you feel we can do that within the time or whether
Sure, let's ask
we
the
can touch
questions.
on it.
Yeah.
Okay, so the question, I have a question about a family history of celiac disease, and
Mhm.
should this be tested for before trying an elimination diet?
I would say that testing is useful, yeah, because you kind of then it gives you a reason. Well, let's say you test and you are positive for celiac, then you definitely know you have to do it. But if you test negative for celiac, it doesn't mean you don't have a gluten intolerance. So the celiac test will, there can often be quite a few false negatives in that because they test for certain markers that will show up a true celiac, but they don't test necessarily for markers that will show that you are still producing antibodies against the gluten or the gliadin protein, but you might be. So there is more sensitive testing that you can do through a company called Cyrex Laboratories. And if you are someone that would like to see the results before doing something, then yes, I would recommend doing that. Either first through your GP and then potentially the more sensitive tests so that you could know whether it's a worthwhile thing for you to do or not.
We've got a question on recommendations for good parent cookbooks or websites for
Mhm.
ideas around being more healthy with fruit and veg.
Okay. There's a good website called Nourished Kitchen,
Okay.
which actually has some, gluten-free recipes there, some dairy-free recipes. I think that can be quite good. There's another website. It's vegan. I don't tend to recommend vegan diets unless someone wants to be a vegan for a particular reason. But Rebel Recipes is quite good. It has some lovely recipes in there, and you could always add whatever protein, your meat, your fish to that. And the reason I mention it is because there's a lot of wonderful recipes in there with fruits and vegetables. So I think that's quite nice. Rebelrecipes.com.
Rebel. Right. I don't know,
Recipes.
Abir, if you want to go to whiz through some information on elimination
Okay,
diets.
sure. Okay. Well, we've touched on it already. And as I said, I think that an elimination diet is a good thing to be considering if your child has ASD, ADHD, and you would like to get to the bottom of their kind of behavioral patterns alongside any other therapies or treatments that you're giving them. As I said, you need to look at gut health, and gut health is impacted by a reduction in oral tolerance, which means that your child may be reacting to certain foods. So there are a number of elimination diets out there. The main one that I would start with would be a gluten-free, dairy-free, and soy-free diet. And to start that diet, it just means eliminating those foods, I would say, for a period of a month. So you need to be 100% when you are eliminating these foods. That doesn't mean that the diet has to become a gourmet diet. It just means that you have to eliminate those foods. And check labels, check packets, make sure that they're not contaminated in anything that you're buying. So planning is key. It can seem overwhelming, but if you plan, then you will generally have the right things at home. And the reason Joe and I were talking about now being a particularly good time to do an elimination diet or to try one is that, children are not at school. Well, they're homeschooling, but not at school. And I know that a lot of parents will say that they don't want to try elimination diets until the holidays because it can be difficult to do it while the child is at school and potentially feeling anxious that their friends are eating what's on the plate and they're having something different. So now is a good time to potentially try something like this. So it would be eliminating those foods for a month. At the end of that month, and with your diary in your hand, with changes potentially in symptoms, both physical and psychological, you would then introduce one of those foods. So let's say you started with dairy, and you would eat that food, or the child would, 2 to 3 times in one day. And you don't have to have tons of it, but do introduce it into the meals 2 or 3 times in that one day. And then stop eating that food at the end of the day and wait 48 hours. And in those 48 hours, you would be recording in your diary any lapses in physical or psychological symptoms. Now, if you're not sure whether there were any lapses or changes, you could then introduce the food again for another day, 2 or 3 times, and go through the same process. If you noted a reaction, then you would know that that food was problematic, and not just at a gut level, but at a behavioral level, a mental well-being level, and you would eliminate it again. And then when the symptoms subside, you would reintroduce the next food, and you would carry on like that with the dairy, the gluten, and the soy. And that's basically what an elimination diet is. So it's not, well, I say it's not difficult. The process is quite simple. It's just about sticking to it and being very mindful of symptom patterns and recording them in a diary and then discussing that with your practitioner. So that is the overall principle behind an elimination diet. And then you would decide either yourself or with your practitioner whether you would continue to remove a particular food or foods for more long term, perhaps until you've been able to go in there and do some gut healing and noticed a real improvement in the child's emotional and physical well-being. And maybe at such time, you would then consider reintroducing those foods. And that would be something I would recommend you did with a practitioner. Yeah.
That's great. So
there are, I mean, do you want me to touch on other healing diets? I mean, there are others, but I suppose that is the main one, Joe.
Do you want to just mention the names of those?
Yeah, okay, I could. Yeah, just so that people know, because I think some parents listening might well have tried a gluten-free, casein-free, which is basically dairy-free and soy-free diet.
Yeah.
So there are grain-free diets as well. And the reason I mention a grain-free diet is because some grains and other foods actually can cross-react with gluten and dairy. So they have a similar molecular structure. And so even if the child goes on a gluten-free and casein-free diet and soy-free and you don't notice much difference, it might be because there are other foods that are similar in molecular structure to those food agents that you haven't avoided that are still problematic. So that would be the second tier. Another diet is the low salicylate diet, which is useful for children with ADHD and hyperactive children. And so it essentially removes food additives, which I would recommend anyway. I hardly think that's an elimination diet, but the food additive part I would say goes without saying, but it also means if you do the elimination diet on the salicylic foods, there are certain foods that contain salicylates which you may want to consider reducing for a period of time, just like the other diet, and then reintroducing again. If your child has gut issues, particularly bloating, like that tummy that kind of goes, in and then way out and then down again, you might want to reduce FODMAP foods, which are carbohydrates that are found in certain vegetables, fruits, and other foods that can cause bloating because they feed on bacteria in the small intestine. So that's another diet, the low FODMAP diet. And then another one is a low oxalate diet. So oxalates, a bit like salicylates, are another agent that you find in certain foods that can cause changes in behavior, particularly when a child seems to be in pain and has very poor energy. And so it actually helps to reduce inflammation associated with pain compounds.
Wow, thank you.
I know there's a lot to take in. It's such a big subject, though, and that's why individualized, personalized nutrition is really key. But there are definitely some steps that I know a lot of you are taking already to optimize the diet, to think about the child's gut health and how you might address that with a practitioner, and then to consider an elimination diet, and then finally the supplements.
That's really amazing, Abir. I have to say, I've worked with Abir, and she does make magic happen, and for our children too.
Yeah.
We are offering, as I mentioned before, a 30% discount on Abir's consultations, and also on Dr. Liz, because, as we keep saying, we really believe that this time when children are at home is such a great time to take advantage of this. But another thing Abir and I have been discussing is the possibility of doing, we could do a more in-depth workshop and perhaps even discuss maybe small group work. So if any of you might be interested in that, we might send out a survey to see who might be interested in something like that and put something out about that. I don't know if you've got any other thoughts on that, Abir?
Yeah, absolutely. I mean, in the past we've done that where we've had, well, in person, of course, nowadays it's online, which is great. But we have done small workshops at Starjumpz before, which essentially the fact that it's small group means you can bring your more individual questions, your particular story, your case with your child, and we can go through it in a bit more detail. And we can also go through the elimination diets in more detail and discuss strategies around how you might want to implement that. And of course, the question of testing comes up, and food supplementation as well. Yeah, so just a bit more detail on each subject.
Yeah, and we've also talked about perhaps for some groups it could be like a course, so that if you're trying an elimination diet, you can come back and meet again. And if we're doing it online, it'll be a lot easier than everyone trying to get to a venue.
Sure.
And so that there's support ongoing from the session with Abir, but also potentially we can create a private Facebook group or WhatsApp group for those people going through that to help each other as well.
I think that would be brilliant, because there's so many questions and every case is slightly different.
Yes, so we'll put out a question survey or something on Facebook and check in with anyone who's interested in that. And do share this with anyone else who you know who might like to find out about what's been talked about tonight, or like to look further into going a bit more in depth with Abir or Dr. Liz, because I really think what they offer is so fundamental to a child making really good progress in all aspects of their development and in their well-being and in how they feel about life, really, just to be happy. And also it can have very positive impact for the whole family as well. I'm just going to check in the comments. We've had some great comment. Dr. Liz has said it would be great to bond with others too from having some group work. I think that would be really great. And somebody's saying that it's quite overwhelming, all the information. It would be really good to get some group support. So some positive feedback on that.
I think, one thing about that, I know that word overwhelming came to me when I was thinking about doing this interview, because I realize it's a lot of information. There's the gut, there's the diet, there's the other strategies, but actually that's why it just takes a little bit of working out. You almost have to be a bit of a detective, working with a practitioner, really ideally, to work out what's right for your child, and then you work in the steps that are right for you. So it doesn't have to be done tomorrow, but it's taking those steps, and each step that you take is actually a step on the route to recovery. So it is all good and positive.
Absolutely. And I think something you've touched on, which is really important, is the behavioural changes as well. And we do have a specialist in positive behaviour support and psychologists and other members of the team, and Dr. Liz's background in psychological services to help support those kind of changes. So that's really helpful as well. So
absolutely,
we've just gone over by a few minutes, and a couple of other comments, but thank you everyone who's joined us tonight. It's been fabulous to have your questions to explore with Abir, and
thank you for asking so many questions. It's great.
Yes. And also thank you to anyone who's watching this later, and I hope you find it helpful, and stay well and stay safe. And just to let you know, we have another Liz Van Gran, who is our lead speech and language therapist, who's going to be talking on Wednesday night at 8 o'clock about supporting anxiety in children who have neurodevelopmental conditions such as ADHD and autism, sensory processing difficulties, or speech and language difficulties. And she's going to be giving some wonderful strategies and tips and tools of how to help your children, to talk to your children about anxiety, even if they're non-verbal. So I can really recommend that. And we've got our play therapist, Pete Nord, who's going to be doing a live on Wednesday morning at about 10 o'clock to demonstrate play therapy in action. And I think I might be his subject, so I'm not sure what I'm going to be doing for that. Bit of art or drawing.
Yeah.
But we also have Abir doing a yoga session on our Facebook page, because Abir also does yoga, so you can check that out as well. I don't know if you'd like to say anything else, Abir, before we just say goodbye.
Yeah, no, thank you very much for everyone who's tuned in, and for anyone later who tunes in as well. If you have any more questions from this talk, do feel free to send them to Joe. I'd be happy to answer them. I know it's a really big area, but an area that can be broken down into bite-sized chunks for sure.
Okay, thank you. And as we leave this, we're just going to post a few things that perhaps you didn't quite catch the names of in the comments. So keep an eye on that, and you'll see them coming up later. So great. Good night, everybody. And thank you very much for joining us.
Yeah, good night. Thank you.